Hi everybody, thanks for watching this video. Today we are here with Mr. Katunzi Mutalemwa.
Yes.
Hello Mr. Katunzi.
Hello,
How are you?
I'm fine.
I'm good too.
Okay.
Mr. Katunzi is here for introducing his book, Narcis, the Cornerstone of the Healthcare System. His new book. So, Mr. Katunzi, first of all, I would like to ask you something about you.
Okay, you're
So,
welcome.
who are you and what are you doing in this period of your life?
Okay, thank you, Mr. Presenter. My name is Katunzi Mutalemwa, as you have said. I'm a nursing officer and currently I'm working as an assistant project manager in a dedicated project for non-communicable diseases with an organization of Doctor of Africa Kwan. Yes.
Where exactly?
I am working at the Iringa district, but particularly I'm found at the Tosamaganga district, the University Hospital.
Okay, and so you wrote this book, Narcis, the Cornerstone of the Healthcare System, and I'm curious about the title. Why, in your opinion, nurses are the cornerstone of the healthcare system?
Okay, thank you for the very good question. I was expecting that question to come first, so thank you. By responding to a question, I decided to write the book about nursing, because nurses, they usually act at the heart of the hospital. So everybody who is working at the hospital has to be in good connection with nurses, because nurses first are the ones who stays longer with patient than everybody to the hospital. But also, despite of working to provide the care, they also act as an advocates for the patient's conditions. So with that sense, I decided to make it clear that everybody should know that a nurse is the cornerstone for everything which is acting at the hospital.
Because do you think that there is somebody that doesn't know?
For sure, a lot of them, they have poor perceptions. They don't know, because you know the system, how it is formulated, especially here in Tanzania. The nurses, they usually be considered sub-skilled profession. So many of them, they usually regard nurses as they are there to obey some orders or directive from other people. So I made it to make them know about the profession, as it is standing as an independent profession.
Okay, that's
Yes.
very good.
Okay.
So how did you get the idea about writing this book?
Okay, I should recall, and I should first say that my idea of writing book came when I was a student. By that time I was studying at Kilimanjaro Medical University College. When I was getting out from the hospital, I found some relatives who was waiting to enter into the hospital. They were trying to debate about the difference between a nurse and doctor. And then many of them, they were like saying nurses, they are like people who do nothing because they cannot stand by themselves. Instead, they should wait for the directive of the doctor. And then something came to my mind. I said, now I'm a student, I'm studying, and I'm struggling a bit to make sure that I soon become a graduate nurse. And yet people, they don't know what the value of the profession which I'm studying. So that cracked into my mind, and then I decided to write a book about nursing. Okay.
That's very interesting.
Okay.
And so you started to write your book, but thinking to speak to whom?
Okay. I think this book is not granted to everybody. This book is specially intended to whoever wish to know the work that is done by nurses. First, might be a nurse themselves, might be a student nurses, but also other people outside the profession. That's why I decided to bring this book, which will act as a junction to join those people. So everybody is entitled to read this book, no matter which profession he or she is coming from.
Okay, maybe it would be useful also for students of the secondary school that are thinking about what to do about their future, that maybe are thinking about to get a job in the healthcare system.
Yes, exactly, because even this book I tried to explain much on how people can try to incarcerate the nursing endeavors, because many of students who are in secondary schools, they rather don't know what is found to the hospital. So they might also get an help with this book to see how to plan to become future nurses. So also I concur with you. Also the students, they must get their copies as
It
well.
might be a guide for them.
For
who
sure,
are
for
interested.
sure, for sure.
And also for nurses themselves.
For sure, exactly. Because we have been operating as nurses, I should first appreciate it that many of nurses, they do a work of which they don't even know where that the profession comes from and what they have to do to be successful in their works, and some important guidelines that might make them to offer the bright services to their patients or clients, sometimes we call them. So it is good actually, even for nurses.
Okay.
Okay.
And what do you think are the main difficulties for nurses today, especially here in Tanzania?
Actually, nurses have been facing a lot of problems here in Tanzania. I should first say that nurses are doing such a great job, but they are less undervalued. They are less appreciated by stating by the people whom they offer services, but also the issue of the salary. Nurses have been working a lot, but they are underpaid. If you try to see, for example, people who have degrees and people who have the diplomas and certificates, sometimes if you try to compare with the other people who are working to the health arena, the way they are paid, nurses are not equivalent to the amount of work they are doing. But also there is such a big problem on people who try to advance in their levels. For example, a nurse who want to become a specialist in a specialty, who can become a psychiatry nurse or a midwife nurse, soon after graduating, they are not yet recognized by the system. So that's one among the problem. But also other big problem, which is becoming as a mushrooming now, there is the entrance of qualification for nurses. We first should appreciate the work that has been done by the Commission of Universities, that somebody to become a nurse might have a certain grade, which is good. But if you try to look on the people of lower level, for example, certificate and diplomas, their values have been reduced to get a mushrooming of nurses, of which it is something which is not good, because they cannot advance to go to degree level, because when they become to the Commission of Universities, they are not well recognized because of the poor performance they have. So these are some of the problems. But majorly, the issue is about the payment. We should first see now we can take the payment so that drives the value of nurses in Tanzania.
Okay, I understand.
Okay.
So the book was printed just some weeks ago, some days ago, probably.
Exactly.
Have you already arranged some presentations?
Yes, so far, because of coronavirus, we are trying to advertise the book by using the online system and making some free delivery to people who make the booking. But my plan is soon after this epidemic, we are planning to take it to other places, making some events to inaugurate, but also to have some co-association with some of nurses associations in Tanzania, for example, TANA, UNISATA, so that when they will be holding some events, I'll be also attending to present my book. But now, of recent, the book is available, everybody who wants can get it, but officially, it will be soon inaugurated after this pandemic disease. Yes.
Okay. And then you have also other projects for your future, maybe other ideas that you can tell us?
For sure. My wish is to become a great writer, and most especially I want to write more books about nursing, since we are still having a lot of problems in this profession. People, they don't want to recognize it as an independent career. So I will come soon with another project of the book, which will be entitled Nursing as an Independent Profession. I think to be released soon, if not there, probably next year. But currently I'm making a book with someone who is my colleague. Maybe soon it will be available. It will be about hypertension. It will be in Swahili, by the way. Yes, somebody will be speaking about.
Yes, because we didn't say it, but this book is in English.
Yes.
In order to make it international.
Yes, to make international. But also I should say that in summary, the book has 6 topics, and I poked just more important issues about nursing. First, it's about the history and the contemporary view of nursing, and the second is about nursing care, and the third topic is about the stereotypical images about nursing. Here, this is the most topic which I really like a lot to read it. For example, some they say nurses are assistant of doctors. Nurses they have a lot of inferiority complexes. Some they say it's a women career. So in that topic you find it, and in the fourth topic there is a multi-dimensional life aspect of a nurse. What does a nurse do since when it enters to the hospital until when they leave? Not only those who are working in the hospital, but even others who are working outside the profession. And the fifth one is about the element of a successfulness. If you want to be successful, what you should do as a nurse. So you found it here. And the last topic is about the ethics in nursing. For sure, now we have been hearing a lot of mistakes, some of malpractice about nurses. I should say that with this book, you will get to know what are the professional strategies that a nurse has to do. Yes.
Okay, so it is really a completely portrait about the profession of the nurse.
I can simply say so.
So,
Yes,
thank you, Mr. Katunzi. This is the book, Nurses, the Cornerstone of the Healthcare System. How it is possible to get it?
Now the book is available on Amazon. If you want to get in Amazon, you can write the Nurses, the Cornerstone of Healthcare System, and you will get it. But
On Amazon you can get it as as an ebook.
yes, an ebook for sure. And for the hard copies, now they are available. I will just try to write the description of my details. You can email me, or you can write me through WhatsApp, and then I will make a free delivery of the book if you want.
Okay, so it will be possible to find these informations in the description of this video.
For sure.
Okay, so thank you, Mr. Katunzi.
Thank you so much.
Thank you, thanks to those who watched this video.
Okay. Thank you so much.